go over not only scheduling but navigating a meeting on Capitol Hill and reviewing many of the talking points that we sent out last week and then this morning as well, and talking points and policy priorities for VNAA that you will receive on site at the Public Policy Leadership Conference next week here in Washington, D.C. And so thank you everybody for joining us, and we look forward to seeing you next week. But then also just a reminder that if you have to jump off, this presentation is being recorded, so folks who are not able to join can review our talking points as well as some of the other information covered on today's call. And so here in DC, it's Nathan Constable at the VNAA, Joy Cameron, our VP of Policy and Innovation, and we also have Eileen on the call from Rubin Health Policy, who will be jumping in and filling in some holes that I might miss. I'll probably kick it to her a few times during this call. So as I mentioned, here's the agenda. We're going to go over our policy priorities and talking points, some tips on scheduling a meeting if you haven't already, what to expect during your meeting, how to navigate who you'll be meeting with, a few tips, as well as what to do after the meeting, follow up, how to best go about doing that. So the first item that we really wanted to talk about are, when it relates to home health, is protecting and preserving access to home-based services. So CMS proposed to reduce home health payments by $180 million in CY17. So this cut is in addition to sequestration and 3 years of payment reductions due to the rebasing of home health payment rates. So we're asking all members of Congress to tell CMS that the cut of this magnitude puts beneficiary access to care at risk and exceeds the statutory limits Congress placed on rebasing for home health payment rates. And another item that we're asking Congress to reach out to CMS about is delaying the rollout, additional rollout of the pre-claim demonstration. So despite opposition from the industry and from Congress, CMS is proceeding with the implementation of the pre-claim demonstration, which is applicable to all home health agencies in 5 states. And it started on August 1st in Illinois. And as I'm sure a lot of people have heard, there have been some issues. There are 4 other states, Massachusetts, Texas, Florida, and Michigan, will be rolled out in the next 3 years. So we're asking members of Congress, I know.
Through January.
Oh.
They're all rolling out.
Oh, yes.
And then it will continue.
Yeah. So we're asking Congress, I know folks in Florida have already reached out to CMS to ask for a delay in the implementation of this. So we're asking any member that you meet with to, they might have signed on to the initial prior authorization letter that went around, but really just bring this point up in your meetings. So as we move on to specific pieces of legislation focusing on home health right now, the Home Health Planning and Improvement Act is introduced in the Senate S578 and in the House HR 1342. So it was introduced by Senator Susan Collins and Charles Schumer in the Senate, Greg Walden and Representative Earl Blumenauer, along with others in the House. So this bill would allow nurse practitioners, clinical nurse specialists, certified nurse midwives, and physician's assistants to order home health services under Medicare in accordance with state law. This legislation would improve access to important home health care services and potentially prevent additional hospital and nursing home admissions. So we're urging both senators and members of Congress to support and co-sponsor this important legislation to allow advanced practice registered nurses to order home health service for the Medicare beneficiaries.
Nathan, can I ask a question? It's Noreen Moscoff. Can I ask a question, or do you want to wait till the end?
No, jump in.
So was this an initiative that we started, or were we just supporting somebody else's initiative here?
This is legislation that we had supported. The Home Health Documentation Improvement Act, the next one, is one of the bills that we really led the charge on. This was one we joined with a bunch of other folks on.
Okay. Because this has been on our legislative agenda for several years, but it also included hospice on our legislative agenda.
So the next slide, there are hospice policy priorities as well.
Okay.
Yeah, he's just going through the slides like we do home health and hospice just because it's alphabetical.
So if I wait, I'll wait.
Yes. Yes, there is
Thank
more.
you.
Okay.
In the next item, you see here the Home Health Documentation and Program Improvement Act. So this was introduced in the Senate by Senators Robert Menendez and Senators Pat Roberts. This bipartisan legislation provides common sense improvements to the currently unworkable and administratively burdensome rules regarding Medicare home health face-to-face documentation requirements. So we are working with Representative Walden and a host of other representatives on getting a bill introduced in the House as well. So we're asking all our members on the Hill to ask their members of Congress to not only support this on the Senate side, but raise it in your meetings with the House of Representatives to show that there is attention being paid to this. It is an issue that we do care very much about, so that when it is introduced, they're aware of it. It's been brought to their attention. Then they might flag it.
This is John Chipinelli. I'm sorry. Can I jump in with a question?
Sure.
Just going back to the prior initiative, it says looking for the change for NPs to be able to basically order in compliance with state law.
Mm-hmm.
If a state's law doesn't directly address the power of an advanced practice nurse to order a service like this, what do you know what shape this would take? Does it just become a Medicare rule and a home health agency that's certified by Medicare could use its staff that way?
The problem is, the Nurse Practice Acts are governed by state law, so if it's a situation where it passes but your state does not allow for it, that pushes you to state level lobbying. That would mean that the door would open up once you had the rule was changed at the state level, the federal level would allow you to do so. Currently, you're blocked on both sides.
Okay.
So this would open it up nationally, and then it would be on a state-by-state instance. The reason some states have greater flexibility with their Nurse Practice Act is largely because of their Medicaid program, and then other just, general insurance, not federal level programs. So if it's not a Medicare or Medicaid, but a private pay, that sort of thing, the states have already gone forward and done this work.
Okay, thank you.
Uh-huh. You want to jump to hospice?
Yep. So moving on to hospice. The first item on here is the Palliative Care and Hospice Education and Training Act, also referred to as PCHETA. It was introduced last year in the House by Representatives Elliot Engel and Tom Reed, and was recently introduced in the Senate by Senator Tammy Baldwin. It enjoys broad bipartisan support in the House with over 180, 190 members of Congress supporting it. It's actually there's going to be a hearing this week. One of the items that we originally sent around was to ask for a hearing on this bill, and it is actually, I think it's Wednesday or Thursday. But this legislation would establish education centers and career incentive awards to improve the training of doctors, nurses, physicians assistants, social workers, and other health professionals in palliative care. I often think of it as the EAR method. So education, it touches on education. Also, there's an awareness component of this bill for the general public, and then also there is money that is set aside for NIH research on palliative care. So we're asking not only for additional support in the House, but really some more support, trying to get some further bipartisan support in the Senate on this bill. So when you're up there, either thank your member on the House side for supporting it, or ask them to get on. It was a bill that we pushed for last year, and it has received a Senate companion bill being introduced, which was one of the asks that we had last year. The next item is the Care Planning Act of 2015. This was introduced by Senators Warner and Senators Isaacson. This legislation would establish Medicare coverage for volunteer team-based discussions of prognosis and care options for Medicare patients throughout the progression of advanced illness, not just at the end of life. It requires that providers' quality be evaluated on whether the care provided aligns with the patient's values. And the legislation also encourages the use and portability of advanced directives across care settings and state lines. So we are urging, but much like our friends at CTAC, thank you for being on the call, Leslie, to co-sponsor this critical bipartisan legislation that ensures Medicare patients with advanced illnesses at the end of life have access to better coordinated and higher quality care. And specifically, we're trying to get more Republicans on this bill. Both Isaacson and Warner would like to see a one-to-one sponsorship of this. So for every Republican that comes on, there will be a Democrat that comes on. Just you know, they are definitely aware of how this issue plays on the Hill, and they really want it. They want to express a picture of bipartisanship regarding this bill. The next item is the Compassionate Care Act. This was recently introduced by Senators Richard Blumenthal of Connecticut and Shelley Moore Capito of West Virginia. It provides federal support to educate consumers and providers about advanced care planning and palliative care, and develop core end-of-life quality measures and test innovations in advanced care planning via telemedicine. And one of the items in this is that it does cover reimbursement of home health agencies for providing telemedicine services. So we are, much like all of the other bills, we're trying to build broad bipartisan co-sponsorship of this on the Senate. So when you're on the Hill, please do ask them to support this bill. And then the last piece of legislation that we have on here is the Removing Barriers to Person-Centered Care Act. This was introduced by Senator Sheldon Whitehouse earlier in the summer. And it would provide, it would test shared savings payment model in up to 20 advanced care collaboratives to deliver coordinated person-centered care to Medicare beneficiaries with advanced illnesses. And each collaborative would receive a planning grant to conduct a needs assessment, modify, upgrade, or purchase health information technologies for education and training on documenting and communicating beneficiary treatment preferences and goals. Under the terms of the pilot program, the Secretary would waive certain Medicare payment rules and regulations to cover 2 new services under the hospice benefit. So it would allow Medicare patients to receive hospice care and curative treatment at the same time. Would also allow nurse practitioners to sign home health and hospice care plans to certify patients for the hospice benefit, and also allows Medicare patients to receive home health services without the requirement that they're homebound. So we are asking that when you're on the Hill, meeting with senators to raise this bill and you know, ask for their support, or for them to further look into it. So before we move on, did anybody have any questions regarding any of the bills that we had just talked about?
So I think Noreen's point on the bill regarding allowing mid-levels to assign home care wasn't so much are we going to talk about any hospice initiatives. It was that traditionally when we've advocated for that mid-level autonomy, we included hospice in that advocacy. Any thoughts on that? Okay,
so you mean as per that we've advocated for the inclusion of hospice and for people to sign on to the legislation? Is that what you're saying? So modify the legislation to include hospice as well as home care, not just advocating for the piece of legislation.
Right. If we were going to advocate for this legislation, we would one of our hopes would be that mid-levels could also sign off as prescriber of hospice care in addition to home care.
Okay.
Right, Joy, this is Nellie. Oh, sorry.
No, I was just saying I didn't understand it before. Okay. Go ahead, Nellie.
Yeah. Oh, yeah, Joy, I'm sorry, I didn't mean to cut you off. So, Trey, this is Nellie River, just historically, I think you're right. I mean, Noreen, you asked the question about where the bill originally came from, and it was very much the Nurses Association folks who spearheaded the bill, and we came along with them because obviously we support it also. But I think historically we thought whether it's in that bill or its own separate bill that also it should be the same allowance on the hospice side. And so I think when we do talk about this bill, we also mention it would be great if it could be expanded into hospice, but that just hasn't been the focus of the bill yet. But I think we have historically echoed that when we talk about this.
Okay.
Does that make sense?
Mm-hmm.
Thanks, Melanie.
Yeah.
Any other questions before we move on? So now we're going to get into, if you haven't already scheduled your meeting, we do encourage you to schedule at least 3 visits. So one with each of your senators and at least one member of the House of Representatives in your district or in the district where you work on Wednesday, September 4th between 1 and 5 is the time that we have set aside that day. So if you haven't already scheduled, here are a few tips for how to schedule your meeting. So call the office of your elected official to arrange for meetings, or visit the website to find the contact information. Sometimes it's on there, sometimes there's a form. If you do have questions, feel free to reach out to me. If you're not getting any response, I can provide you with either a staff contact or the best way to go about reaching out to them if you're hitting dead ends. So when calling, identify yourself, including the name of the organization you represent and where you're located, and ask to speak to the health staff or the office scheduler. And also specify the purpose of your meeting, which is to discuss federal health care policy affecting home health and hospice providers and the patients they serve. And also, you might have a relationship with a member of Congress, and you believe you might be able to obtain an audience with him or her. So don't hesitate to ask. And also be sure to establish the date and meeting time, and be flexible as well. But be flexible between that 1 and 5, because congressional staff are busy and they really are hitting the home stretch. They don't have much time left. But then also make sure to leave plenty of time between the House and Senate visits, as it takes about 20 minutes to walk from the Senate to the House side or vice versa of Capitol Hill, and try to schedule your Senate meetings together or your House meetings together. So in preparing for your meeting, read through the advocacy packet, either that you have, that we provided for you starting this week and reviewing on the plane here. Identify and practice the story that you want to tell. You know, Nalene, Joy, and I, we go up to the Hill and communicate the message, but the personal stories, the on-the-ground information is really what does resonate and raise the, it perks the ears of the member, of the staff, because it just does. And learn your policymakers' positions as well. So look on the website, search Google, find there might be an angle. There might be some documented story that they often tell about their family in hospice or home health or something like that. So just being able to connect with them either on that level, on a policy level, so you know how best to really go about your ask or how you want the meeting to go. And then also review recent news or social media activity of the policymaker. Maybe they put out a tweet about hospice or home health or pre-claim or something like that. So it just means that it's top of mind, you're paying attention. All these things will definitely help that meeting go a little bit smoother. And Nalene, did you have any tips that you wanted to add?
Nope, you covered it. Thank you.
No problem. So what to keep in mind when meeting with a member of Congress or with your staff? So the first is to be on time, but don't arrive more than 5 minutes. And if you do, just hang out in the hallway, because a lot of these offices, especially on the House side, are quite small and too small to accommodate larger groups. And then always inform the schedule that if you are going to be late, inform either the scheduler or the person that you met with that you're running a little bit behind. And then be flexible. So prepare to meet with either the member of Congress if you set it up, or the member staff. Sometimes their schedules don't allow, or if you were supposed to meet with, you know, the chief of staff, and for some reason they get pulled into something, you might be meeting with a health LA. So definitely be flexible, but always keep the same message, because everybody that you're going to be meeting with is going to inform the member of Congress on you know, their policy positions and how, you know, what to consider when thinking through things. So definitely be flexible, but always treat them with the utmost amount of respect. And stay on topic, because you don't have much time in these meetings. So, you know, always raise the issue that you're scheduled to discuss with the member or their staff, and really keep it focused, because in that limited time you want them to be focusing on that issue, asking the questions, and then keep politics out of it, because it might seem like not a lot of people can agree on much in DC, but there are, you know, we do have some bipartisan bills here, and, you know, really touching on political views and stuff like that might just murky up the water and not have the meeting go the way you want it to go. So really focus on the issue at hand, focus on the policy positions, and keep the politics out of it. And always leave behind brief information about your organization and about the talking points that we provide, contact information if there is follow-up, and make sure you take notes in case there are any questions asked, any follow-up information that you need to get back to them. Nalene, did you have anything you wanted to touch on what to keep in mind?
Nope, you've covered it again. You know.
So always expect to, you might have, as I said, you might have a meeting scheduled with a member, but expect to meet with staffers during the Hill visit. So we've laid out, you know, the hierarchy, or just the people who make up a congressional office. So there's a member of Congress, the chief of staff, the legislative director, the legislative assistant, and a legislative correspondent or staff assistant. A lot of times you'll be meeting with either chief of staff, the LD, the legislative director, or the legislative assistant. And especially with the legislative assistant, you know, they might look very young, but members of Congress often look on these staffers for guidance and recommendations on policy positions. They really specialize on the healthcare issues that you're focusing on when you meet with them. So definitely, I know I said it before, and I don't expect anybody not to, but please do give them the utmost amount of respect when meeting with them. Nalene, did you have anything that you wanted to touch on?
I guess the only one thing, and this is from earlier, when you're, and I know a lot of people on this call have done meetings before, but one other way to schedule a meeting, you know, obviously there's call the front, the main line, which you can get, you know, off their website and just ask to speak to the healthcare staffer or the scheduler for the office if you're trying to get a meeting with the actual senator or a member of the House. But you could also, if you are, in addition to leaving a voicemail, because usually you won't talk to the staffer, you then would leave a voicemail asking to meet on whatever day. But you may also ask the front desk for the staffer's email address, and an easy way to request a meeting is just to email them. And that may be quicker than sometimes even a phone call. So don't feel shy about emailing if they give you the email address, because that's how most people, or a lot of people, communicate with them. So that's another way to do it that's maybe even more efficient than trying to play phone tag. Just in terms of scheduling, and then likewise with follow-up when you go to send a thank you, often emailing them a quick 2-sentence thank you will be good.
Great. Thanks, Nalene.
Sure.
So here's some additional information about navigating a meeting. So remember that you only have about 10 to 30 minutes to meet with each legislator or staff member. So be polite, professional, focused, and focused on your priorities. And read through the list beforehand of stuff you want to discuss, and be prepared. So explain the impact of the policy issue in question through a personal story. Like I said earlier, that does really resonate and connect with not only the members but also the staffers. state up front the specific policy ask, the reason why you're there. Get right to it, and then talk about the impact. And then be sure to write down any questions that are asked of you, so that if you might not have it, you can get it to them right after. So that'll serve as extra incentive to follow up and thank a staffer for their time that day. And then, like I said, leave behind printed materials or booklets or just one-pagers, so you have additional, so that the staffer has additional information on your organization. Is there anything else that I might have missed that you wanted to touch on?
Yeah, I mean, a couple of things. If you hear in the meeting either good or bad that somebody likes one of the bills we're talking to them about, and they say, boy, you know, I'd like to try to get my boss to sign on to this bill, which means they have to sort of run it up the food chain to get permission, you may want to let Nathan know about that so that we can then also sort of tag team and do the follow-up, because we know all of you are busy and you can only follow up so much. So if you let us know if someone seems quite interested, we can make sure to follow up in a proactive way. And then on the not so good side of the equation, if somebody says, boy, I have lots of concerns with this bill, or concerns generally on something, if you could let us know about that, because again, we can follow up afterwards and make sure we provide them with whatever info is needed.
Great, thanks, Melanie. So then after the meeting, always stay active during the meeting, or the day of, following the meeting. So share your experience or relevant social media on relevant social media sites. So we often see people tweeting out a picture, or posting on Instagram, and tweeting at the office that you were there meeting, and then send an email to the staff that you met with and thank them for their time. It will really help to build the communication with the staff member. Do that as quickly as possible. I understand that you'll be heading back, so 1 to 5 days after. And then, if you want to, do write a personal handwritten thank you note, thanking the policymaker and staff for their time. And then, if you do have the time, try to schedule a follow-up meeting in the district, 4 to 6 weeks after the meeting, to really keep these issues top of mind for that office. It's important. Milleen, is there anything else that you wanted to add regarding follow-up?
Nope, nothing here. Thank you.
So I think that covers the items that we were talking about. Does anybody have any specific questions? I see there was one about the Compassionate Care Act in a House version. Not yet. No, there's not. But it's something that you can bring up and with your member of Congress during a constituent meeting or something like that, and maybe they'll look into that.
This is Joy, and I would just say too, something that I stress to several people when they're making their meetings, and when we talk about sharing your story or your perspective, we really mean that of your agencies. And a phrase I keep using a lot is facts, not feelings. Face-to-face is an administrative burden. I may hate it, but what I want to be able to express to them is the burden and the slowdown, and how this is a lot of administrative time that could be better put to caring for the individuals, doing a better job of coordinating, etc. So for me, it's a little bit of the facts, not feelings, assessments, not judgments, kind of pushing that frame of reference through. Some other organizations, like to go and talk about, the frontline approach and what is going on with the front line. I think that if there are outcomes that you can share, I think if you can show that, how your programs are best responding to the needs, whether they're home care or hospice, I think those are going to be extremely important to share with the members of Congress. I think being able to share ways that you all have been innovative and you've worked, amongst different payer systems and different models, etc. I think those are all things that would resonate really well with this Congress. They are not in session much longer at all. This is an election year. It goes without saying. When Nathan mentioned in the slide about don't mix politics politics with your meeting, that also means a check. Don't even mention those. They cannot accept them when you're there, and it's a big violation. So just a little asterisk beside that. Not that any of you, most of you that are on the line are practice folks that have gone to the Hill before. So are there any other questions you all might have?
Hi, this is Elizabeth Buckley from Trinity Health at Home. So unlike, I guess, most of the people on this call, I have not had visits on Capitol Hill before or met with legislators in that fashion. So I'm hoping / assuming there's some kind of like guide. I don't even know, how do you get there? How do you get in?
Yep.
All that.
Our on-site guide does have what the map is. We're happy to talk one-on-one with you about any of the meetings you have so that we can walk you through where you need to go. But yes, we have the ask to ask. We have directions available. We are actually not too far from Capitol Hill, which is nice, and we can help you get there appropriately. I would say make sure you do have your ID and no weapons, please.
Okay. I'll leave those.
Right. Thanks. I'll leave those in the hotel room. Anything else? Great.
Good deal. Well, thank you everybody for joining us today. Thank you, Nalini, for your time as well. And like I said, if anybody does have any follow-up questions, anything you could not think of today, please email me. My email address is on the slide. It's nconstable@vnaa.org. If you're having trouble setting up some of these meetings, I'd be glad to help put you in contact with the right person. So thank you everybody for joining today.